Right, well this is a great pleasure to be here today with Tessa Turnbull. My name's Lawrenson and I work at the University of Auckland and look after the medical students in Waikato. So Tessa, it's a great pleasure to have you here today, but also you're going to be our orator for the conference, and I'd just like to ask you what you're going to tell us all about.
Okay, I have called my oration Looking Back, Looking Forward, which kind of takes a look at the history of general practice in the college, weaves in a little bit of my own experience and tries to look forward a little bit to give the new fellowship graduates a little bit of inspiration for their futures.
So what do you think have been the greatest changes over that time?
I think quite clearly the move from being the doctor in the practice to being part of a large collective group delivering care. And for many doctors it's been quite difficult to give up that power and delegate it to others, but it's quite clearly been for the benefit of our patients.
So one of the things that struck me is we've had lots of structural change in the health services over the last 30 years. What influence do you think that's all had on general practice?
Well, having been in general practice for over 35 years, not much. Things go round and round and round. We're still very much hospital centred. We've talked about integrating primary and secondary care for many years. The reality of that hasn't occurred, or has occurred so slowly that it's hard to notice. So it would be wonderful to see that reality come true.
Yeah. Another thing from my point of view has always been the next generation of doctors, and we've always appreciated the care you've taken of our medical students from the university when they've come to you. Do you want to talk about the changes in our medical students and the experiences you've had with those students?
Yes, we started off having overseas students initially,
right.
And I think we did give them a very basic understanding of rural practice, because Calicut at that stage was quite a long way geographically from Tauranga, very bad roads, a lot of one-way bridges. So a little bit of understanding about that, and then we've had undergraduate students for many years, and more recently 2 of the doctors in our practice have trained as teachers, so we now have registrars in the Calicut practice.
Right. And what do you think the future is for those young people coming out now? Are they going to be working as you've worked, or do you think the future is different?
No, one of my current roles is an assessor for the college for vocational registration, so I have the privilege of meeting lots of young doctors. The profile has changed. Over 50% of the students are now women, of the graduates are now women. They do not wish to work as we worked. I mean, we worked 24 hours, 7-day a week call, and then did our normal 5 days a week call for just the 2 of us when we first came to Calicut. I think the change in after-hours care has been the biggest change and the most beneficial change. There's no question about that to quality of life. The worst change, I think, has been the loss of obstetrics. I reiterate John's words this morning at his address, because obstetrics is such a fundamental part of our practice, particularly as a young doctor, because you got engaged with young mums and children and older children as they grow up, and eventually adults. So those 2 have been the biggest changes that I've seen.
I guess the other change is probably technology. Do you think that's had much of an impact?
Yes, it has. Being a rural practice, we've been confounded by the difficulties of poor access to, or slow access to broadband. But yes, it's made a huge difference to the way we practice.
So Tessa, thank you very much. That's been really great to hear that, and we're looking forward to your oration tomorrow.
Thank you.
Good.